What is the difference between vascular dementia and frontotemporal dementia? When it comes to understanding dementia, two types often come up: vascular dementia and frontotemporal dementia. These are distinct conditions with different causes and symptoms. Let's break it down. Vascular dementia is primarily caused by reduced blood flow to the brain. This can happen due to strokes or other conditions that affect blood vessels. When the brain doesn't get enough oxygen and nutrients, it can lead to damage. On the other hand, frontotemporal dementia arises from the degeneration of neurons in the frontal and temporal lobes of the brain. These areas control behavior, personality, and language. So, the damage in frontotemporal dementia is not mainly about blood flow but rather about brain cell health. The areas of the brain affected also differ. In vascular dementia, various brain regions can be impacted depending on where the blood vessel damage occurs. In contrast, frontotemporal dementia specifically targets the frontal lobes, which are responsible for decision-making and personality, and the temporal lobes, which are crucial for language and emotional regulation. When it comes to symptoms, vascular dementia often presents with issues in thinking, planning, and judgment. Memory loss may not be as noticeable at first compared to other types of dementia. Symptoms can appear suddenly after a stroke or develop gradually. In contrast, frontotemporal dementia usually shows significant changes in personality and behavior, such as apathy or compulsive actions. Language difficulties are also common, while memory loss tends to be less prominent in the early stages. Age of onset is another key difference. Vascular dementia typically affects older adults, usually those over 65 years old. It is the second most common type of dementia after Alzheimer's disease. In contrast, frontotemporal dementia often affects younger adults, with many being diagnosed between the ages of 45 and 64. The progression of these conditions also varies. Vascular dementia can worsen stepwise due to repeated vascular events. Frontotemporal dementia usually leads to a more gradual but relatively rapid decline in cognitive functions related to the affected brain regions. It's important to note that managing cardiovascular health can help prevent or slow the progression of vascular dementia. In contrast, there is currently no cure for frontotemporal dementia, and treatment focuses on managing symptoms and supporting behavioral changes. Accurate diagnosis is crucial for both types, often involving neurological exams and brain imaging. In summary, vascular dementia is linked to blood flow issues affecting older adults, while frontotemporal dementia involves brain cell degeneration in younger adults, leading to behavioral and language changes. Understanding these differences is vital for appropriate care and support. Always consult healthcare professionals for personalized advice regarding dementia and its management.